Well, the spread of the Omicron variant has led to a spike in vaccine demand. The CDC reporting an average of under 1 million doses a day, with boosters and first-time doses driving the demand. Dr. Dan Fagbuyi joins me now. He's a physician and former biodefense and public health appointee for the Obama administration. Dr. Dan, good morning to you. It's great to see you.
Good morning. How are you?
I'm great. Thanks for asking. You know, we're seeing an uptick in people getting vaccinated. So how important is it that people get vaccinated right now? And do we know more about how the current vaccines are protecting against this variant?
Sure. Great question. It is important for folks to get vaccinated right now. Delta variant is the predominant one right now, and that's really what the focus should be. I would say, based on the data we're seeing in terms of hospitalizations and death, the vaccines are still doing what they're supposed to do. Remember, I mentioned previously on here, it's not a force field. It is basically a shield, and it is doing what it needs to do. Until I see cases that have increased where I'm having to intubate, put a tube down people's throat in the emergency department and send them to the ICU that are vaccinated, I still am waiting. So that's good news. I think we need to put this in perspective. The sky is not falling, contrary to the 007 movie.
All right, so you feel that the vaccines here are working, but what role do booster shots play in protecting people against this variant? And do you think that we're going to need a fourth shot? I know that Israel is now saying that they're going to start rolling out 4 shots here.
Yeah, so we have, so in the United States, let's focus for us here. We really need to focus on getting people who haven't been vaccinated, get vaccinated, should they show will to do that. But I think that's really the focus. The 4th shot, that's great and all. I'm still ambivalent on some parts of the booster for certain population members. So as of now, this is my stance. This is not the government's stance, of course. I think those who are immunocompromised, who are at risk, and based on the new CDC guidelines, all those who have gotten their previous primary set of vaccine should get that booster. And it should protect against, at least there's evidence of neutralizing antibodies. So that should be helpful against any types of variants. Remember, these are all against the ancestral variant that first began, that alpha, and it translated into the beta and to delta, and it should be effective also against Omicron, even though it might be slightly decreased. Let's say, I'm just picking random numbers, 70%, 80% effective. That's still good. If I'm not tubing you, putting a tube down your throat, or sending you to the ICU, that's the big picture.
Right. Some immunity is better than none at all. Dan, I wanted to ask you about what we're learning about this variant specifically. How is the virus mutating? I've heard that the variant has picked up parts of the common cold. Is that right?
Yeah, so that's based on a preprint now. I underline preprint. Preprint meaning it is not peer-reviewed. We haven't really poked holes at it. But it's interesting data, also somewhat scary because the cold virus is one of those that's very contagious, right? Spreads easily, but it's also not as bad. So that's the good news. So let's look at the glass half full here. And I would say that that's good news in a sense, but it also shows how freaky these viruses are. Like literally, they mix them with genetic material, with everything. Figure out that, and you can read between the lines on that one.
It's really scary. All right. Dr. Dan Fagbuyi, physician and former biodefense and public health appointee for the Obama administration. It's always great to see you, my friend. Thanks so much for joining us today.
My pleasure. Thank you.